Hi, I'm Cassie, and today I am going to be doing a intramuscular injection, and I am going to be doing that in the vastus lateralis, and we are going to be doing Rocephin 1 gram. So, first I would make sure I have all of my supplies, which I do have out, and then I would make sure and wash my hands, do a good hand hygiene, and then I would do my 6 rights. So the right patient, today it's going to be Skip Rocker. His birthday is 1/1 of 1972. The right drug, which we are going to be doing Rocephin 1 gram. The right route, which is intramuscularly. The right dose, which is going to be that 1 gram. The right time, which is every 12 hours for 6 days, and so that 12 hours is up, so we're going to be doing that now. And then we're going to be doing the right documentation as soon as we're done with the procedure. So I am first going to be checking, I have to reconstitute this Rocephin, so I'm going to make sure I have my powder and I have the correct reconstitution, which these are just some practice vials that we have. And to get the correct strength, you need to administer 6 mLs. That gives you 500 milligrams per mil, and I need 1 gram. So I'm going to be doing 2 mLs of this when it is reconstituted. So I'm also going to be having a different needle than what I'm going to administer to the patient. So I will first need to take a bigger syringe than I'm actually going to use on the patient. I'm going to snap these lids off, throw them in the sharps container, get my alcohol wipe, alcohol both of those off, so they are nice and clean. I'm going to take my 10 ml syringe and get my 6 mils drawn up. So I'm going to need 6 mils pressurized so that I can pull the 6 mils out of my liquid, my reconstitution, into my powder. So I'm going to get my needle out, and this is just going to be the needle I use to reconstitute and pull up into my other syringe, and then once that's over I will have a new needle. So I'm going to uncap this one, leave that down so I can recap it later, grab my 6 mils. This is a big needle, but it's the widest gauge we have just to make this easy. So we're getting there. I'm gonna make sure I try to get all those bubbles out. Obviously I'm gonna have a little bit left of this vial, but it is a single-use vial, so I will not I will make sure and get all those out. Perfect. So I have 6 mils in there that I'm now going to stick into my powder. And when I do it, I roll it around a little bit so everything gets nice and saturated. It's a little easier to wait for it to reconstitute. Get my air out of there so it's not pressurized. Do that again until I can push all my liquid back in. Okay. Perfect. So I have now taken 6 mils of air out, and that's so that that vial will not be pressurized when I go to take the amount out. So I'm going to take this needle off of my syringe, and my syringe is going to go in the sharps. And now I'm going to put this needle onto my syringe that is going to have the amount that the patient is going to be getting. So like I said previously, I'm going to need 1 gram, which is going to be 2 mLs. So I'm going to pull that up. I'm going to look and make sure that this is completely reconstituted prior to me giving that. I'm gonna mix this up because it isn't quite reconstituted yet, and it does take just a couple minutes. Perfect. So I've got my 2 mils of air. I'm gonna take my needle again, go right back in at a different spot so you don't core it. Push in my air. Make sure all those bubbles go away. Perfect. So there I have my 2 mils, which will give me my 1 gram. I'm gonna take my needle off. I have my good needle that I'm gonna give, which is 1.5 inches long, and it's 22 gauge, which is correct for the intramuscular. So I'm now going to double check, just make sure everything looks good. I'm gonna now go into my patient room and get started with this procedure. So, knock knock. Hi Skip, how are you doing today? He says he's good. I will do my 2 identifiers. Can you give me your first and your full name and date of birth? And he makes sure and tells me. I double check his allergies. He's still only allergic to Celebrex. Awesome, Skip. We're going to give you a injection into your muscle right here on your leg. And so I will find those points on his leg, and it's gonna be right in between. It's gonna be right here. So I have now found that point. I've got it marked on here. I do hand hygiene. I'm going to take a pair of gloves. Put those on. Double check my orders. Make sure nothing has changed. No one else has given it today. Okay, so we're gonna be doing this method in a Z-track. So I'm going to make sure and hold the skin taut with my non-dominant hand while I inject, and then I'll stabilize with my non-dominant hand. But first I will aspirate. So I'm going to uncap my needle. So I know, Skip, this is gonna burn really bad, but if you can just hold still for a couple seconds, it'll be right over. So I am going to just double check everything. And first I'm actually gonna alcohol my area. Since I have it pointed out of the spot I need to go, I'm gonna start in the middle and just work myself out. Not gonna touch anything that I've already went over. Perfect. So now I'm gonna uncap, and I'm going to put my hand right next to it, pull over. I'm going to make sure he knows I'm gonna poke him. I'm gonna poke in 3, 2, 1. Aspirate for 10 seconds. Doesn't look like any blood's coming out. That's great. I won't have to start over. So now I'm gonna slowly press this into him. I know it stings, Skip, I'm sorry. So as I inject, as soon as I'm done, and I pull my needle out, I'm gonna let go of my hand, and that locks that medication in. So 3, 2, 1, pull out at the same time. I'm not gonna recap, I'm actually gonna do the safety. Dispense in the sharps. I'm gonna blot the site. Are you doing okay, Skip? I know that hurt. He lets me know he's doing fine. I blotted that area. If need be, I can do a Band-Aid. Is there anything else I can get you today, Skip? He lets me know he's fine. He doesn't need anything else. I give him his call light and make sure his bed is back into position. And I document that I gave 1 gram of Rocephin intramuscularly into his vastus lateralis, and sign off that I did complete that. Awesome. Thanks, guys.